Good day, fellow nurses. My name is Elena Rumble. Today, for the nursing class 4050, Patient-Centered Care, I will present topics connected to care coordination, discussing evidence-based and culturally sensitive strategies for collaborating with patients and family members to attain positive health outcomes, and change management aspects affecting patient-centered care. I intend to identify different facets that directly impact components of the patient experience that are critical to providing high quality, patient centered care and explain the rationale for coordinated care plans related to ethical decision making. I will discuss the logical ramifications and consequences of an ethical approach to care, as well as the assumptions that guide decision making. I'll also examine the influence of some of those healthcare policy provisions on healthcare outcomes and experiences. I am attempting to draw rational, evidence based practice conclusions from an in depth analysis of essential and relevant policy provisions and increase awareness of the nurse's significant contribution in care coordination and continuum of care. What is care coordination? Designing a case management strategy demands establishing what patient information is necessary and where the coordinator sends the patient. For the recipient to reach optimal health, the program shall treat the person considering physiological, educational, social, emotional, cultural, and financial demands. Care coordination is a well-organized program that links individuals to the resources they need to be healthy. Management of care is an essential aspect of patient care. Whenever a doctor diagnoses with a new condition or diagnosis, the patient's life is turned upside down. A new disease might create uncertainty, but the chances of effective disease management are poor without the necessary resources. Resources are made immediately available to a patient or a group through a detailed care plan, enhancing the quality of care and ultimately improving the patient's well-being. Hannigan et al., 2018. Economic benefits of case management across physicians, specialists, and locations seem to be a central component of healthcare findings as well as delivery mechanism revisions. Quality healthcare management could be an answer to a divided healthcare system, according to some studies. It also has the potential to greatly improve results, enhancing patient satisfaction, but also reducing prices. Kohler and Kolsky, 2018. Let's see now what is evidence-based care coordination. Patient and family involvement in care coordination is identified as a critical component of the program. According to the participants in this study, patients' willingness to participate in care coordination is vital, just as it is for the primary care providers. Many participants share stories of patients who were eligible for care coordination but refused to participate. Patient qualities such as lack of enthusiasm and interest, unfamiliarity with available resources and services, financial need, health status, and access restrictions have been highlighted as barriers to participation and sustained use of care coordination. The care team members emphasized the need to address patient activation and motivation as part of care coordination. They agreed that having a care coordinator to identify patients' goals rather than provider goals and a plan to attain them is critical to achieving patient involvement. The professionals have concerns regarding an over reliance on care coordination as a barrier to self management. They explored improving patient adherence and reducing reliance on care coordinators by identifying and engaging family or other caregivers who could work with them. Williams et al., 2019. Let's see now what's the role of ethics in care coordination. The nursing profession uses the Nursing Code of Ethics and ethical principles to maintain a high practice quality. The Nursing Code of Ethics is a set of guidelines for healthcare workers to follow to provide holistic and effective care to patients. Healthcare providers must complete the work ethically and morally to ensure patient safety. The Nursing Code of Ethics comprises 9 sections that explain the nurse's ethical responsibilities to the patient. The nurse's responsibility is to set up, maintain, and improve patient care. ANA 2019. The detailed arrangement of patient care plan is the subject of care coordination. This care plan must be compatible with the patient's attainable goals to be effective. The nurse establishes a framework for the patient to express their health objectives and requirements through encouraging autonomy. This provides a positive environment for the patient, which leads to better outcomes. Hannigan et al., 2018. To preserve a patient-centered framework of care, beneficence must be practiced in healthcare. The act of prioritizing the patient's well-being is known as beneficence. As healthcare practitioners, it's our responsibility to assist and encourage the patient's well-being. We must examine the patient and identify which resources would be best enhance the patient's well-being while coordinating a plan of treatment. The principle of non-maleficence is founded on the notion of above all else, do no harm. ANA 2019. The justice principle emphasizes the patient's right to equitable and just treatment. This principle is especially critical when putting together a coordinated treatment plan for your patient. The patient must receive tailored care that is beneficial to both the patient and their families. Because no two people are the same, no two care plans can be the same. Patients can have the right to have health care tailored to their requirements. ANA 2019. Now we're going to look how change management aspects are affecting patient-centered care. Because healthcare is constantly evolving, we receive training to be adaptable even from nursing school. Many professionals are content with the status quo, but as nurses, we should trust principles to help us overcome aversion positively. As nurses, all nurses can be change agents, individuals or groups with formal or informal lawful power, whose task is with directing and guiding change. We must view change as a win-win situation for all parties concerned. One of the change management models will be beneficial to the success of the shift. Lewin's change model is widely implemented in nursing and is undeniably an essential factor influencing a patient's outcome. It is critical to use a thinking strategy that includes all professionals who can impact the change's success. Maney et al., 2018. Lewin's field theory proposes a three-step process for changing organizational behaviors. Identify the forces that encourage the current behavior, changing the pattern of behavior, and striking a balance that protects previous behavior from recurrence. We use it in nursing practice. Kurt Lewin's change model is unquestionably significant in determining a patient's outcome. It has an impact on the patient's experience as well as the level of satisfaction. Nurses may need to help their patients and families adapt to a new way of doing things for their health's sake, providing support and comfort during a transition and underline the value of change while providing the care. Two examples are teaching the proper method for changing a dressing or getting a blood pressure reading and knowing when to call the doctor. Lewin's three-step method is a system of reasoning as to what promotes transformation. Meany et al., 2018. Change is required to enhance patient outcomes. The result should be beneficial when used in conjunction with scientific studies, education, and dedication, and patient outcomes will improve. Whenever a patient perceives that their medical team has thoroughly addressed every area of their care, they seem to be more likely to be satisfied, which will positively impact their overall result. Meany et al., 2018. The effects of policies on healthcare coordination. Legislators design healthcare regulations to ensure that organizations provide patients the best treatment for every specific condition, guarantee all patient safety and well-being, and receive the same level of treatment. The Affordable Care Act of 2010 is an excellent illustration of policy provisions. It is far from being perfect, but a project as large as the Affordable Care Act may deal with some stumbling blocks along the way. The Affordable Care Act resulted in one of the most significant expansions of the health care coverage in American history. Before this policy became a law in 2010, about 16% of our population did not have insurance. By 2016, the number of uninsured dropped to 9%, a historical low. Since the executive branch implemented the Affordable Care Act, over 20 million Americans have obtained health insurance coverage. Coverage increased across all income levels and among children and adults due to the Affordable Care Act. And discrepancies in coverage between races and ethnicities have decreased. The expansion of Medicaid and the debut of healthcare insurance exchanges for private coverage were two of the American Affordable Care Act's most significant coverage expansion measures that went into effect in 2014. These programs currently cover tens of millions of people in the United States. Nicole Rapfogel, 2020. What's the nurse's role in care coordination? According to the American Nurses Associations, nurses play a critical role in the care coordination plan's implementation. As nurses, we must encourage and facilitate care coordination. Registered nurses' skill sets include designing a personalized health care plan with other participants of the interprofessional team, especially for high-risk patients, health consumers with serious health issues, and their caregivers. Nurses must work with an interprofessional team to manage resources, to develop a care plan for specific patients as an element of delivery of health care. The nurse's role in patient-centered care coordination is critical because They collaborate with the patient and also a variety of clinicians to develop an effective care plan, ANA 2019. As registered nurses, it is our task and duty to encourage and support all patients' health. Registered nurses play a crucial role in designing and managing care management programs in hospitals and health systems, which are meant to meet the healthcare needs of patients with challenging